Hello from Miami. Welcome to our next episode in patient education around total knee replacement. We're going to discuss in the next 3 videos different ways that we can affect complication rates through lifestyle change, medical intervention or monitoring, and also physical limitations. So let's start with the lifestyle modification or change and how it can impact your specific risk of complications. Again, this talk pairs with my book with the same title, A Proactive Approach to Knee Replacement. I'm Dr. David Graybill, and I'm hopeful that this is helpful to many of you. A lot of these specific complication talks involve more than just total knee replacement. They would be applicable to any larger surgery in many ways. Certainly the first 2 are, and also would apply to hip replacement. So basically, lifestyle activities have a very significant effect on our on many things. They're responsible for a large impact on chronic disease later in life, and they also can impact your ability to recover and avoid complications from a surgical intervention. So moving onwards, my topic today will be on diet, and we'll make the statement, which I'm sure many of you heard, you are what you eat. And indeed, what your diet is going to affect many things in your life. Here we're going to talk about specifically protein, although there are other parts of our diet which also have significant impact in our recovery from surgery. So when people came into my office, I'm currently retired, but I would have this discussion about surgery being kind of like running a marathon or a long distance triathlon, basically like running a major race. In other words, if you don't prepare training wise, obviously you have a problem, but also if you don't prepare nutritionally, you won't do as well. So if you don't have the right fuel, you don't drink enough fluid, you're not going to be able to perform at your maximum. And here, obviously, we want to get through a surgical event in the most ideal fashion possible so that we don't have additional risks of problems. And specifically with protein, it's very important because our protein needs to go up dramatically after major surgery or injuries. And the references for this are within my book, so I'm not going to repeat those, but protein requirements go up very substantially around a surgical event. And literature says about 250% increased needs compared to your daily needs. If our reserves are low, then we have a major problem because the immediate recovery is going to try to draw from your reserves, and if they're inadequate, then we're going to fail at something. And these include wound healing, immune function, in addition to muscle recovery. So obviously this is something we would want to optimize so that we can recover well. And of these, the wound healing and immune function really can affect complication rates. Muscle recovery is obviously very important too. And many patients, as we get older, have lower muscle mass, lower protein stores, and there's something called sarcopenia, which is where we have a very low muscle mass, and that can be really a setup for a significant problem. And I would point out that these things in the immune function will overlap with other issues, perhaps smoking. Smoking is another major factor in infections. And if you have low protein and you're a smoker, you're adding 2 negatives together, similar with diabetes and other factors. So we should address those. And I've got many other topics within the book besides protein here. But focusing on protein itself, protein malnutrition is really quite common. It's actually very common also in obese patients, which might seem counterintuitive. I think as we think of malnourished people, we think of people that are very frail looking with very small, low weight body habitus, but we can also have protein malnutrition and sarcopenia even if we're heavy. And in studies, again, the references are within the book, but up to 2/3 of surgical patients come to surgery already malnourished on protein. So this, I think, is a significant number, a significant problem that can be addressed. There are several strategies. There's been some preoperative nutrition supplements designed. Those are certainly favorable, but I would point out that protein malnutrition takes years to develop, and it doesn't go away in a week. So it's something we need to address as early as possible. So when we look at complications, and again, I go over this quite a bit in the would book, state that deep infection is probably the worst complication after knee replacement that we see. It's still relatively uncommon, probably in the 1% and less category, but it is substantially increased in rate if we have low protein levels. We have trouble getting our wound to heal. A non-healing wound is associated with deep infection. It also is associated with poor immune function, also increasing the risk of infection. And again, as I stated earlier, many times people that have protein malnutrition have other factors that worsen the rate of complications or stack on top of those. So speaking here on the protein malnutrition, this is something you can influence. You can change your diet. So moving on the topic of how to address this situation, literature suggests that it takes a minimum of 4 weeks of a high protein diet to document improvement in protein levels. That doesn't mean that if you have less than 4 weeks, you shouldn't increase your protein. You should certainly increase it. Any improvement in your diet will be helpful. But overall, you really want to start very early. So if you're even considering knee replacement, you may want to consider improving your diet at this point, because the earlier you start, the easier it is to accomplish this. The sources of protein are variable. Obviously, people understand meat as a great source. It is. Beef, pork, chicken, fish are all great options. But dairy is also very good. Egg whites are 100% protein. And vegetarians or vegans can also consume a lot of beans. If you're struggling to get enough protein, there are supplements available. So start as early as you can. The longer you have improved your protein in your diet, the more likely you are to get a level which is healthy. People ask how much protein. The literature suggests if you're somewhat low on protein, you want to consume between about 0.5 gram and 1 gram per pound of body weight. So for a 150-pound person, that's quite a bit, anywhere from 75 to 150 grams. If you're 200 pounds, that's 100 to 200 grams. Those are a lot of servings of meat. Eggs have, egg white is, in a single egg is 6 grams of protein, for example. So it may be a little challenging for many people. Therefore, there are supplements. There are a number of supplements out which are now low in net carbs, both in drink form as well as protein bar form. So I really encourage people, if they're struggling to get anywhere above that 0.5 or higher grams per pound, that supplements are a great choice. I pursued this myself aggressively, even though I eat probably above that 0.5 on a regular basis and have for decades. I tried to get as close as I could to 1 gram per pound, prior to surgery, increasing egg whites, adding a protein supplement, and then trying to increase my meat portion and displace any starches or carbs, so I didn't gain weight. That's how I approached it. Again, wound infection, deep infection are horrible complications. You can do things that positively influence that rate. There are many other things that can be done for medical, lifestyle, and physical problems, which are again addressed in my book, which I encourage you to use as a resource prior to surgery. I hope this talk has been helpful to a topic which I always felt was very important for patients and tried to emphasize during my discussions prior to surgery. I really encourage you to think about the things that you can do proactively to influence your outcomes. So we'll move on to another talk in the near future. I hope this, again, is helpful and that you have a great day. Thank you again.